Gastroenterology is an ambulatory specialty. We raise our residents and our medical students thinking that the hospital is important, but it really is an ambulatory specialty. So we focus on ambulatory medicine. Our fellows have 2 continuity clinics each week where they have their entire own patient population. They start off with 3 new patients and 6 follow-ups. And then when they're on a major rotation, they may have additional clinics with the faculty for that rotation. We maintain that ambulatory bias throughout the entire program.
I was interested when I came to interview, but when I got here, it was pretty clear that this is a program where you'll get excellent training, both in the ambulatory setting and as far as procedures go. We have a small but very dedicated core group of faculty. We only have 6 fellows, and so everybody knows everybody. Got people in your corner the whole time.
We understand the importance of the practice of medicine. So we focus on practice guidelines, we focus on practice management, we teach billing collections, we teach compliance, we teach OSHA, we teach Medicare, and all of the modifiers that people need to do for their billing to prepare people for their practice, be it an academic practice or a private practice after they finish their fellowship.
We have an ambulatory experience that is second to none, and we pride ourselves on the fact that when you see a patient in the clinic, it's your patient and you do the endoscopy on your patient. They're not anybody else's patients, they're your patient, and that very closely approximates what the real world is.
And there's also nothing in the world of gastroenterology that we don't do here. So you can get experience in every facet of gastroenterology. And so that was nice for me as well, because I wanted to get a well-rounded education.
For each of the 36 months of fellowship, we have an electronic curriculum that utilizes resources for independent learning activities, for reverse classroom, and for teaching programs with the faculty.
One thing I really like about our program is from day one, you are getting trained in endoscopy. There's no waiting period or anything like that. Of course, there's an attending right behind you, telling you, watching you and telling you how to go.
Most fellows graduate with about 800 upper endoscopies and about 800 colonoscopies that they've performed throughout their fellowship. So we're not at the highest end, but we're well beyond what the ACGME requires, which is 200.
So we have continuity clinic all the time. You scope your own patients. You have a lot of autonomy in their care, but there's always someone that you can talk to. You're never alone.
The university and the College of Medicine and the residency programs have a major commitment to a variety of different formal wellness programs. In GI, our fellows look out for each other. They have to treat each other like family. We look out for each other, we look out for our fellows, and we are absolutely committed to their medical education and their well-being.
We fish together, we hang out, and so it's good to have that environment in what is otherwise can be a stressful period in training, and so it's nice to have that with you, have that sense of community with you, and that was very important to me when I was coming in, and interviewing.
Well, I've been directing this fellowship program now since 1990. We've had 56 fellows enrolled in the program. They're scattered throughout the United States, on faculty at Massachusetts General, Harvard Medical School, on faculty at Mayo Clinic in Rochester, and in private practices from Alaska to Florida. Success in the program is for our graduates to be comfortable in their practice environment, to grow and be leaders in their community and their university. Of course, pass their boards, and we have a 100% board passage rate. And of the trainees that have left us, boy, I'm awful proud of every single one of them.
We also have access to any sort of equipment or training that gastroenterology has to offer. We just opened a brand new state-of-the-art facility on the 3rd floor of the hospital. About half the 3rd floor of the hospital is the endoscopy center now. There's nothing in gastroenterology that if you want to do it that you can't do at USA.